If you're on a medication like semaglutide, tirzepatide, or the brand names Ozempic, Wegovy, Mounjaro, or Zepbound, listen up. I've got habits that I make my patients adopt, otherwise we can't really proceed with those medications. Plus, I'll give you one bonus that I've been using recently for the appropriate patients. It's no secret that when you're losing weight rapidly, it doesn't matter the source, you're at risk for losing muscle mass. We see this a lot with semaglutide and tirzepatide. How can you prevent that muscle loss? A non-negotiable amount of protein. My patients need to be taking in roughly a gram per pound of body weight. This will make sure that you are supporting your muscle mass by giving it signals to maintain itself instead of burning off for energy purposes. With this, strength training. And you don't need to go crazy with this. I'm talking about 3-4 days a week, 30 minutes, well-designed, a lot of big movements, compound type exercises like squats, chest press, shoulder press, rows, deadlifts. The same things that will help you with your bone density, they're also going to be helping with that muscle mass that prevents worsening metabolic health after you come off the medication. You want to make sure that you have insurance policy against that weight regain. That's where muscle comes in. So how should you design those strength training days? If you're doing 3 days a week, split them up, lean into one muscle group area, a little heavier on each of those days. So you're not really overtraining as much, but you're giving the muscles a nice continuous signal to maintain and build themselves. If you're new to the channel, you might not have seen all the discussion with peptide therapies. There are some of these that work by increasing growth hormone release during sleep. It's a pretty nice feature to have when you're trying to build muscle, burn fat, maintain bone density, and prevent weight regain. These work very synergistically with semaglutide, tirzepatide, but a lot of them are not FDA approved, so you need to make sure that you are safe for these and discuss it with your own physician. Now, these are going to have names like sermorelin or sermorelin, tesamorelin, ipamorelin, CJC1295. And what those do is when you take them before bed, they facilitate a stronger release of growth hormone during your sleep. So you've recovered better despite that calorie deficit, and you'll be ready to burn more fat tomorrow.